everyone's having a wonderful start to your day. Excited to have our second panel for the Food is Medicine series of virtual panels for our summit. I am excited to be joined by four experts who are going to be talking specifically around medically tailored meals, prescription food, and what is going on and what are the opportunities and challenges that exist in this space. For those of you who are familiar with Food is Medicine, there is a Food is Medicine pyramid, and what the next three panels will be really walking through are the different areas of the Food is Medicine pyramid. We are starting at the top and the peak of the pyramid today when we talk about how are we looking at individuals and how we can provide medically tailored meals, and what are the opportunities in partnership from public and private partnerships. The next two panels will focus more into food security and how we look at that and nutritious meals for those who are facing food insecurity. And then we also will have a panel on how we're looking at population health behaviors and specifically focusing on the opportunities in digital health. So excited to have those coming up next week, and I'm really thrilled to have this panel here today. So I'm going to first introduce Nick. Nick was one of our planning committee members. Excited to have Nick here. Nick works for Project Angel Heart and will be our moderator for today's panel. I'm going to kick it over to Nick to get us moving today. Oh, you can't unmute yourself. I did that. There you go. Sorry.
Thank you. Thanks, Sarah. Hi, everybody. As Sarah mentioned, my name is Nick Susi. I'm the Government Affairs Manager with Project Angel Heart. Very excited to be here with you all today, and I'm excited to introduce you to our panel of experts in food as medicine and specifically medically tailored meals and groceries and medically tailored food. So I'm going to run through introductions, and then we'll let each of the panelists speak a little bit more about their areas of expertise. So on our panel today, we have Erica Pena, a leader at MyFit Foods, bringing expertise in public health and exercise science, and she'll be drawing on her experience in behavioral health and community wellness. We have Kate Johnston. She is the Chief Operating Officer at Project Angel Heart, a Colorado-based nonprofit that prepares and delivers medically tailored meals and advocates for food as medicine. With over a decade of experience in healthcare, she has led community-based initiatives to enhance health for children and families, specifically focusing on social determinants of health. And we have Mandy Nuku, the Executive Director of Feeding Colorado. With extensive experience in government relations across 16 states, she focuses on bipartisan, evidence-based solutions to improve nutritious food access. She is a member of the Colorado Food Systems Advisory Council and the Healthcare Partnership Task Force for Feeding America. So to kick us off with our first question, I'd love for you each to just give a quick overview of your organization and talk to us a little bit about why you got engaged in food as medicine. And I'm going to have Sarah pull up those slides for us, please, because our presenters have put together quick overviews of their work just to illustrate some of what's going on. So Kate, we'll turn it over to you.
Thanks, Nick, and thanks everyone for joining us this morning. I'm super excited to be here. You can see the vision for our work at Project Angel Heart on the screen. I'm not going to read it to you, but we started in 1991 as a response to the HIV epidemic, and specifically to the isolation and stigma that folks were experiencing when they were living with HIV. Since then, we've expanded from food as compassion and community to food as medicine. We now serve over 600 diagnoses. This year, we're on our way to serving over 800,000 meals to more than 5,000 Coloradans living with cancer, kidney disease, heart disease, protein calorie malnutrition, to name a few. And if you'll advance the slide one, when we think about food as medicine and medically tailored meals specifically, for us, this is what that looks like. We provide homemade, or made in our commercial kitchen, our homemade, fresh, medically tailored meals that combine protein, healthy fats, starches, vegetables, everything we know that is needed to really help prevent and treat conditions from a nutrition standpoint. when we think about medical tailoring, it may mean substituting roasted red peppers for tomatoes for someone with kidney disease, for example. And, Nick asked kind of how did I get involved in food as medicine? I had a friend several years ago who was a client here at Project Angel Heart, and I got to see firsthand the impact that medically tailored meals made on his ability to stay independent in his home while he was being treated. And then, for me, that ability to connect an evidence-based public health intervention with community-based support that feels really personal to our clients and their families was just incredible. And I swear I have the best job in Colorado. I'll toss it over to Erica.
Can you hear me? Awesome. Hi guys, how are we doing? My name is Erica and I am with MyFitFoods. So kind of give you a quick overview of MyFitFoods and Fuel for Change. Fuel for Change is specifically a new initiative under MyFitFoods that we are working towards to help provide more meals throughout the state of Colorado. Our mission here is to really make healthy, great tasting meals accessible for everyone, especially low-income individuals, individuals with adverse health outcomes, chronic disease, behavioral health needs, and physical needs, and specifically Medicaid. Really, the goal is to take the guesswork out of achieving optimal health when it comes to healthy eating. Now, what's really cool is I'm from Rhode Island, and back home in Rhode Island, this is not an initiative that's talked about. And when I came to Colorado, it got me so excited that this is a topic that's really taking off because I think about a lot of friends and family back home that could have benefited from this. So about 2-3 years ago, my team and I here at MyFitFoods, we went to a FMIC conference where we met Kate, and I probably came across you too, Nick. And we realized that what we're doing with MyFitFoods and soon to be Fuel for Change, it's really about helping people get the meal that they deserve so that they can achieve the health outcome that they need. And through the lens of having a healthy meal, we have an opportunity to help with what Project Angel Heart and Feeding Colorado is already doing. And we're really excited about this because we realize food is such a critical role in healing and preventing those chronic diseases. So with that being said, what we're doing is a proof of model concept with Fuel for Change. It's very simple. We want to deliver fresh, high quality, tasty meals that people want to adhere to because it's tasty and convenient. And our goal is to help support what we're already doing as providers and add to that. So down the road, we can help justify state-funded nutrition models. The big picture here is really to treat nutrition at the core of healthcare and not have it just be an afterthought. And as we know, if we can do this together, which this is why it gets me so excited, we're going to have fewer rehospitalizations. We're going to help lower healthcare costs, and we're going to be able to help more people. Now that second slide there, that gives you kind of a glimpse of one of our amazing meals that we create. All of our meals are locally sourced, high protein, portion control, and they use the right ingredients to help achieve the right outcome. And there's a little QR code if you want to learn more about us with that little stick figure there. You can check that out as well. I'm going to go ahead and pass it off to Mandy.
Hi, everybody. I am Mandy Nuku. I am the Executive Director of Feeding Colorado. Feeding Colorado is the state association for the 5 Feeding America food banks. Together, those 5 food banks serve every county in the state alongside our approximately 1,200 hunger relief partners. We are really engaged in food as medicine at the medically tailored groceries level, produce prescription, as well as connecting neighbors to nutrition security programs like SNAP. I am just the coordinator of all of this innovation. It has really happened and been started at the food bank level. Food Bank of the Rockies has done an incredible job of really beginning to enter this space from a food bank perspective with their Food for Health program. And we really see engaging in food as medicine as an opportunity to address both food security and nutrition security. Food security being when all members of a household at all times have access to enough food to thrive, and nutrition security being consistent and equitable access to healthy foods that promote health and well-being. And most importantly, we see this as an opportunity to be on the side of prevention, which tends to be less expensive and more effective. Additionally, it really leverages the strength of the food bank network, which has ties to manufacturing, to retail, to agriculture, and most importantly, to community and to neighbors. We reinvest in our communities and provide services that are trusted by those neighbors and patients. As I said, we're embedded in every community. We reach every county in the state, and often people who experience high rates of chronic disease and systemic barriers to health. You can go to the next slide. As I mentioned, the program that we are looking to scale across the state, across our food bank network, is around nutritious food boxes, or that layer on the pyramid of medically tailored groceries. Right now, that looks like 6 months of weekly home delivery of food boxes, a rotation of food and fresh produce, approximately 11 to 12 meals per week. And there's recipes, nutrition education, as well as what I mentioned earlier, connection to existing federal nutrition programs. So we ensure those neighbors' patients are enrolled in SNAP if they are not already. And then that nutritious food box is followed by produce prescription cards. And during that time, there's, like I said, connection to nutrition education, and additional community resources. So we really try to build a full scope of services. And I look forward to sharing a little bit more in some of the future questions. So thanks for having me here today.
Thank you all so much for kicking us off with a little bit of background about your organizations and your specific work. So as we can tell, food as medicine is a pretty broad topic. So there's lots of work to be done across multiple areas of food as medicine, everything from, policy and implementation to, to funding and looking at how we're going to pay for these interventions, and also making these interventions work for the individual. So I'd love for you to each share your unique perspective on where you feel it's most important to build urgency within food as medicine. And I'm going to have Erica kick us off.
Great. So let's start here. It really goes back to the data because numbers don't lie. By 2030, 130 million people currently who have chronic illness, those rates are going to rise to 170 million. 2023, we spent $4.9 trillion in healthcare costs. And when you look at it, food is still underutilized. So when we think about building urgency, it really comes back to serving our underserved communities, because that's where it's really hitting hardest. Specifically with food deserts that have minimal access here in Colorado, those rural areas near the Eastern Plains in the San Luis Valley, and then also bordering Eastern and Western Denver. So when you think about it, there's high density fast food in a lot of these areas, specifically around Denver. This was like a little test I did back in my community since I live in Aurora. I went and drove for a mile, and within that mile, there were 19 fast food restaurants. 19 fast food restaurants. And thinking about that and thinking about what we're trying to do is decrease healthcare costs, make sure people have the right food and the fuel, and then really what they need in order to have the optimal health, that's not helping at all. So if we delay this, we know that it's going to get worse, and it's going to put healthcare systems strain, specifically with workforce shortages and burnout. But what we need to do is look at it through the lens of how we can urgently collaborate as a provider team here. So Kate, Mandy, and how we can integrate this directly with our healthcare providers, because it's really easy to go fast alone, but we can go further together if we figure out how we can collaborate.
Thanks, Erica. You make some great points points about making healthy food more accessible to folks. You know, where we are not setting folks up to success is just not making these options available. So I appreciate you bringing that up. Kate, let's turn it over to you.
Yeah, I would kind of piggyback off where Erica started for us. You know, I really think about the urgency to change the systems that have gotten us where we are. There's a saying in healthcare that the system you have is perfectly designed to get the outcomes you're getting, right? So the system we have is designed to keep people ill, make it hard for them to get the healthy nutrition that they need. So when I think about urgency, I think about what are referral systems to getting folks access to nutrition supports? Do systems like SNAP include enough money that folks can buy healthy foods? And to Erica's point, is there a grocery store in their neighborhood where they actually can buy it if they have the funds? And then really urgency around payers to support nutrition supports in healthcare. So I know this came up on yesterday's panel, and really, you know, this is work that is relatively new in the spotlight. It's not new work, but it's new in the spotlight. And I think folks are used to it coming from a nonprofit space or a space where they don't have to pay for it. And so how do we build urgency around payers, not only to get their clients access to it or get their patients access to it, but actually fund it so that those, you know, organizations like the three of ours on the screen today can sustainably do the work.
That's great. Thank you, Kate. Mandy, what are your thoughts?
I totally agree. Thank you. Building on both of you about that really focus on access. And obviously in our work in food banking, we advocate for and operate federal nutrition programs like SNAP, TFAP, the Emergency Food Assistance Program, the CSFP, which is for older adults. So there's a number of federal nutrition programs that we operate. And I would say that my lens and background is government relations. So I am going to say that the urgency is really around policy. Um, Irrespective of particular parties' wants and needs, I strongly believe that thoughtful policy can change outcomes in communities. And we see that. We see that with policy in Colorado. And continuing to leverage the strength of federal nutrition programs and then what we can do here in the state. And I so appreciate Kate's comment around this being this innovation happening a lot of times at the nonprofit level, and our connection to the community and seeing communities' wants and needs and challenges and barriers to health. And so having the policy at the state level that allows for a wide variety of organizations to engage in this work, to be paid for this work, so that it is sustainable. And to build systems for collaboration, I think is incredibly important. I think I'll talk about it in some future questions, but layered interventions, I think, are the most successful for those long-term health outcomes, ensuring that people do not drop off. And Kate, I'm so glad you mentioned SNAP, because ensuring benefits have adequate levels to purchase healthy food is an incredibly important part. Not only is it incredibly important for the patient or the neighbor accessing SNAP benefits, but it's also important for the economic revenue it generates for our community. So, you know, for every dollar of every SNAP dollar utilized in the community, it regenerates, I think, $1.54 in the community. So there's both sides to that piece, and ensuring that federal nutrition programs are robust and can support people's health needs and be what they are intended to do, be supplemental nutrition assistance program. And our network supports and integrates with that. And so many neighbors that access SNAP are also supported by our community of hunger relief partners. So important conversation, and just the policy to grade funding, looking at all sources. This is not just a federal program, it is state dollars. We're working with our state Medicaid agency, working with corporations, payers, health systems, to make sure that we can continue to sustainably deploy our various interventions.
Thank you, Mandy. I really appreciate how all three of these answers kind of work together. Almost as we're talking about the food as medicine pyramid, we're also looking kind of within how to advance food as medicine. And we're talking about kind of the whole range of where we can intervene from the individual level to the systems and payers level to the policy level. So I appreciate that we got kind of that full perspective there. Kate had touched upon how food as medicine is really being brought into the spotlight right now, and I couldn't agree more. Food as medicine as a concept and an idea, I mean, it's been around for centuries. People have always kind of looked to food for nourishment and healing and community, which is what we're looking to do with the food as medicine movement now. I would say in the past few years, especially since the 2022 conference on hunger, nutrition, and health at the White House, we have seen food as medicine just be talked about. You know, it's exponential growth in terms of the conversation around food as medicine. So with that, there are quite a few new folks looking to get involved in the food as medicine space, from nonprofits and for-profit partners and entrepreneurs and innovators. And so I'd love for you each to talk to us a little bit about, innovations that are happening within your work and what you would like for entrepreneurs and innovators and funders to build on and learn from your expertise and the work that you've already invested into food as medicine. Kate, why don't you kick us off?
Thanks, Nick. I think you said it perfectly, right? Like food as medicine is not new. It's been around for as long as people have been around, but the spotlight is new and the interest is growing. And so I think my gut reaction to the question is I want innovators to take a pause so that they can understand the existing landscape, and really take a moment to identify and understand the gaps. There is more need than any of us can fill alone. And there is plenty of room and work for us to all play nice together in the sandbox, right? And that's what our communities need us to do. And so, I really get excited about thinking about how innovators can identify those gaps that we all see, experience, struggle with, and create innovative solutions that maybe haven't occurred to those of us who've been in the space for a bit longer. Just because the spotlight is new doesn't mean we're quite at a clean slate.
That's great. Thanks, Kate. Mandy, what are your thoughts?
Yeah, I appreciate the question around the innovation and connecting. And Kate, you're so right that nothing is really new here, and there's long history of cultures leaning into food as medicine and that being a core component of health. I would say that our area of expertise really is looking at the access to food and food insecurity and how that drives health outcomes. And one of the pieces is around partnerships and collaboration. I think recognizing and lifting that up where that can happen, supporting that. This is not starting from a brand new place. There are so many incredible organizations doing this work already. So how do we to fund, innovate, support the technology, the compliance, the billing, all of these challenges for the organizations who truly have the most accountability to communities struggling with these barriers. There's been a pretty recent study on medically tailored groceries and food banks and federally qualified health centers in Michigan. Credit to Dr. Dawn Opal, who's participating in that, and a colleague of mine. Where you really see the innovation there that is happening is addressing one of the most challenging barriers in improving health outcomes for those facing food insecurity. And that is when you have a food insecure person, you often have a food insecure household. And they are one of the first studies to address that and look at that. So not only are they providing medically tailored groceries for that individual, but they are also addressing that for household size. And in that, you see true reduction in both food insecurity that's improved, and you see improvement in health outcomes, reduction in A1C for patients with pre-diabetes. So you cannot address just one individual. Rarely does that work. And so I think about that innovation. And so that's what came to mind today, is talking about that. Like, how do we support beyond that one individual, because it is never an isolated issue, or rarely is. And so I think about the innovation that can happen there. And that's why I say policy and braided funding, because it's going to take all of us to do that in a new way. So yeah, I'll stop there.
Thank you, Mandy. You brought up some really great points there. Erica, what are your thoughts on this question?
Yeah, I love this question. To add to what Mandy and Kate were saying, I 100% agree. Us being newer to the food as medicine scene, our goal is to learn from what you have already implemented and add in addition to what you are doing in order to help more people together. So I think absolutely, I am new to this. There's a lot of learning, and I'm excited to learn from the best, but there's a lot of opportunities for us newer to the scene. For our expertise, the biggest thing to focus on really is scalability from the start. And to break that down, how do you take a great product and fit it into real world systems? So we have to think about the billing, the logistics, the eligibility, the adherence to the program. Um, where we have a really strong strength is getting the meal to the person, building awareness about what we do in our community, and following through to ensure that they're achieving the results that they want. So when you think about adherence, it's taste and it's the education component. You can give a kid spinach, he's probably not going to eat it. But you can throw it into a healthy smoothie and he's going to love it. So what we do is we create such a great product where people enjoy things from the beginning, and the follow-up is what allows them to stick to it. So if we can start thinking about systems of follow-up and inspecting that they are following through, that's where we have a big area if you're newer to the scene. And if we can do that too, like share the solutions that are working among new entrepreneurs and innovators, we're all gonna help everybody win. So I think just creating a space where we have this platform, no idea is a bad idea. And if you have a good idea, share it. That's what we need from our entrepreneurs and innovators.
Thanks, Erica. I love this energy of collaboration on this call right now, because I think you all make really great points. Like there's great work that's already been happening and continues to happen. There's really great partnerships that enhance the work that individuals are doing. And there's so much that we still can learn. So it's taking a little bit of all of what you said, and looking at the past, looking at what we've done, and also looking at how we can make it better. So appreciate all of those thoughts. I'd like to call it back to earlier when we were talking a little bit about the area of food as medicine where you feel we need to build the most urgency. And you all had great and very different answers. So I'd like to hear what you all imagine, or what you think the challenges or pain points that you're facing in each of those areas that could use a little bit more innovation. And Mandy, why don't you start us off?
Yeah, well, earlier I did focus on policy, and I would say there's models out there that are successful, both federally and state, in this work. And policy often is about funding and braided funding. I think about the lessons we've learned from early childhood programs, where you have support from federal programs, federal dollars that come down to the state that are supported by the state, from a variety of levels, as well as philanthropic dollars and community investment dollars. So I do think there's layered approaches to that policy. And just like we've said already, the challenge around building a network of collaboration, especially in times of scarcity and uncertainty. And, our Colorado budget, state budget is a challenge in addressing that from a Medicaid perspective. So it really does require innovation, collaboration, and thoughtful approaches that can be scaled. And I think about the opportunities for collaboration, and I think a great example is between our two organizations, where we can invest in programs and pilots, and being able to do that and really see the outcomes of what does it look like when we provide medically tailored meals for 12 weeks, followed by medically tailored nutritious boxes. And then making sure those individuals are connected to nutrition education, to SNAP, and then to ongoing community resources. With that, like you mentioned, Erica, that follow-up and that piece around support, because in our experience, like we have to address and acknowledge that for us, for the network of Feeding Colorado and our food banks, food is rarely just the only challenge. It does not, food insecurity does not live in isolation. There are so many factors. So this is just one. So if we are going to do this, like the challenges around addressing that, that is so much bigger than food and the barriers to health. And so I think just getting the support of innovators, we've been able to previously have amazing partnerships with DoorDash to deliver those meals. That's been a long-standing program outside of Food is Medicine for some of our older adults programs. So I think just really truly building this network of collaboration that can be the most effective for changing health outcomes and improving food security.
That's great. Thank you, Mandy. And I appreciate that you brought in collaboration, not just within food is medicine specific organizations, but more broadly food and nutrition organizations, and also other organizations and companies that address social determinants of health more broadly. I love your point about food insecurity is rarely just food insecurity. It doesn't sit in isolation. I know at Project Angel Heart, we are constantly receiving calls from our clients asking for support around housing, transportation, other needs. And part of that is because we've built that very, established relationship with our clients. They trust us to come to us with those needs. And so being able to support them and not just say, no, we just do food, that is so important. And so I love that. I kind of want to highlight that for, innovators and entrepreneurs who are listening in on this and thinking, how can I get involved? How can I help? Don't just look at the food piece, but think if you have, skills and expertise and resources in other areas, how else can you plug in to the more broad social determinants of health network? So thank you for that. Kate, I'll turn this over to you to talk a little bit about some of the challenges that you think we're facing and how we could innovate a little bit more.
Yeah, one of the things that I am really loving about this panel today is it feels like we represent kind of the whole food is medicine pyramid that we talked about earlier, right? Like we have pieces of each level. And, when I think about Project Angel Heart, we are very much the top of that pyramid. We are kind of the highest intensity intervention for the patients who need the most support. That doesn't mean folks are going to stay at that level of the pyramid forever. And that doesn't mean folks who aren't at that level yet won't get there. And so one of the pain points that is very front of mind for me that love some innovation help with is how do we seamlessly move patients along that pyramid, right? How do we move them from a lower touch, lower cost intervention into a higher tier or back down as needed? How do we close that loop between community organizations? How do we securely transmit data? Things like that. And then thinking of data, Erica did such a great job kicking us off this morning, talking about data and like providing some really, really important statistics for this conversation. One of the things that I can tell you is incredibly tricky as a community-based organization is getting clinical data to evaluate our work. We are not part of a health system that has and generates its own data. And so how can we partner with folks, or how can we generate data? I know there was conversation on yesterday's panel about using continuous glucose monitoring, for instance, to evaluate in real time your work. I also want to mention that like both of these pain points I just talked about, there is work happening in the innovation space on both of those. A lot of that work really is geared towards big health systems, big organizations that have big budgets. And so how can innovators, take those lessons learned and make them accessible to smaller organizations with smaller budgets who are on the front lines and are doing the same work, but maybe aren't able to invest at the same level?
Thank you, Kate. Yeah, it's this idea of building like a generative food as medicine model where we have, the big healthcare systems who are collecting and looking at and requiring that that clinical data? And then how are we tying that to the community-based organizations who, as you said, are on the front lines, who are engaging with the clients and have that more personal connection? It all feels necessary. And I think finding ways to innovate between those two very different systems is very important. So thank you. Erica, over to you.
Great. Thank you, guys. To build on what Kate and Mandy mentioned, we know the given number one opportunity is access of affordable, healthy food. To expand on that, looking at the socio-ecological model, and Kate, you hit this on the head with community, that's really a big area that I can see us providing more support with. Because if we're looking at how do you transition from people from the top of the pyramid down, it is going to be the same thing. It's going to be having those support systems within our community. So there's actually a really cool program that's going on at Aurora Public Schools, Project Power Initiative, and it ties into what Mandy was saying. It's like they're providing funding for early childhood education around these things. This is exactly what Aurora Public Schools is doing. It's starting kids out with teaching them the educational component of eating healthy early on as a preventative measure prior to when you get to the downstream and it's already happening. So I believe that community programs and educational efforts is huge. The second part of that I see an opportunity in is potentially creating and coordinating more efficient delivery systems amongst Project Angel Heart and Feeding Colorado and our other providers here. Because if we can figure out a way where, I'm looking at our huge map of Denver right now, if we can find a way where we can feed more areas systematically and figure out the logistics on the back end, we're going to be able to help more people. So those were, I say, the biggest opportunities. The challenges are going to continue to be state and federal funding with Medicaid, Medicare, and speeding up those processes when it comes to the client leaving the institution to actually becoming qualified for the meals, along with the trust barrier, excuse me. My Rhode Island accent comes out every now and then. So the trust barrier itself, to break that down, is a lot of people have bad experience eating healthy food. So how do we create this trust with our clients and with our members that healthy food, it doesn't have to be hard. It doesn't have to be bland. It doesn't have to taste like you're just have to eat like chicken, rice, and vegetables. It can taste awesome, and you can continue to achieve the results and the health outcomes you want. So it's how do we build that trust back with those who have lost trust in the past?
Thank you, Erica. We have a saying at Project Angel Heart that we believe that food is medicine, but we don't want it to taste like it. And that's kind of exactly what you hit on there, is if we are delivering food that tastes like medicine, folks are going to throw it out, and then we're all wasting our time. So
Totally. I
I
don't
think
like the
that's a
taste
great
of
point.
a bit small. It's not good.
That's a great point. Well, I want to leave a little bit of time for questions at the end. So why don't we wrap up this part of the discussion by talking about what excites each of you about what is possible in working on food as medicine. And with that, if you have any action items for folks on the call, that's great. But mostly I just want to hear about what makes you excited about this work. Erica, I'd love to hear what makes you excited.
Okay, so I'm excited about a lot of things. I'm a young buck in this industry. However, food is finally being recognized as essential healthcare, which is amazing. When we think about not just the healthcare component, what's really exciting is we have an ability to reduce potential food waste in this country. I actually found this stat, Mandy, from Feeding America, but they were talking about food waste and 92 billion pounds of food waste every year. That's 145 billion meals annually. So if you actually take a can of tomatoes, right, a can of tomato sauce, you could take 5 million cans of tomato sauce and put them across Colorado, and that's pretty much equivalent to how much food waste. So that is a lot. That's billions of dollars lost in our economic value. So what's exciting is with the for-profit and the nonprofits, if we can come together, we're not only going to help people feel better, we're also going to start to reduce food waste. An action item I want to think about is building scalability and sustainability. So for those on this call specifically, my question is, how do we take solutions that work for hundreds of people in the state and make them work for millions?
Thank you, Erica. Mandy, what gets you excited about working on food as medicine?
I guess there's two very somewhat different pieces, but I would say what excites me is, and I think kind of connects to some of the earlier comments about Kate, you mentioned the need for evaluation and those clinical data to evaluate the effectiveness. And as we really push for that and need that, I think we're going to really find what is successful in changing outcomes and changing patients' health outcomes and with sustainable solutions. And I think the study I mentioned earlier around participation in a food as medicine intervention was associated with improvements in patient health outcomes, food security, and diet behaviors. And it showed the potential for partnership between, in this case, it was food banks and safety net providers to alleviate food insecurity and improve health outcomes. So I think that is exciting in how we do our work. We really do in the food bank network intersect with all parts of the food system, agricultural partners, retailer, manufacturing, they're at transportation, food storage and distribution. This is all of the components of our network. And I think it will allow us to do our work better in a way that actually makes a significant change. We really focus at Feeding Colorado on what are we doing to nourish neighbors now? What are we doing to reduce food insecurity? And ultimately, what are we doing to end it? And when we talk about ending it, it looks like it's a truly emergent network rather than one that is part of neighbors' ongoing strategy for stability. So I think the combination of healthcare, and we know that is a driver of food insecurity, of chronic health conditions and barriers to access to healthcare. So just the connection allows us to be more effective. And then the last piece I'm excited about, I'm a lifelong Coloradan. I grew up in Southern Colorado, deep roots in the agricultural community. And I think a piece that is often missing from the food as medicine conversation is around agriculture and local agriculture. How do we build and integrate local ag into the healthcare system? It is part of healthcare. And I think there is options for bipartisan innovation in Colorado with regenerative agriculture and really looking at how we can do that work in a creative way with partners that are either state agencies or funders, innovators, whatever that can look like. But that is a really important part of our work here in the state.
Thank you, Mandy. I'm glad you brought up the point about agriculture as well, because I agree. I think it's a piece that's overlooked a lot in food as medicine. We're always just talking about, okay, we have the food. Now, how are we getting it to patients? How are we making sure it's the appropriate food? How are we building it into systems? But the work starts way before the meal appears. So I think I'm glad you brought that point up. Kate, over to you to talk a little bit about what excites you about food as medicine.
I'm really excited about the increasing recognition of food as an effective piece of clinical care, both for folks who already have a diagnosis and it's kind of another tool in a clinician's toolbox, but also as we think upstream and think about prevention and prevention of morbidity and mortality due to chronic disease. As this gets more attention and as the evidence base grows, I think we have a ton of opportunity to really improve quality of life for all of us. And that's both for, patients themselves and community members, but also for folks trying to take care of them, right? And so just the potential there is so exciting to me. And the conversations like this one that are really focused on connecting across levels and building collaboration and building momentum. I don't know that these conversations were happening 5 years ago. And so as we see these grow and as we see increased recognition and value in this space, it's super exciting to think about everything we can do together.
Thank you, Kate. I couldn't agree more. And actually, excuse me, speaking of collaboration and what we can all do together, I do want to give a quick plug. So Project Angel Heart and Feeding Colorado have come together recently to launch the Food is Medicine Coalition Food is Medicine Colorado, which is a coalition of organizations who are actively providing food as medicine work or engaging in policy or interested in providing food as medicine in the state. So there's a lot of collaboration that is happening that we're very excited about. And that goes to one of the questions that I saw in the chat are what are some good food sources outside of Food Bank of the Rockies? When clients lack food, it impacts others' work. And so everyone's always looking for more food resources. One of the goals of FIMCO, this Food is Medicine Colorado group, is going to be to map food resources, especially food as medicine resources in the state, because I do think there is kind of a lack of general knowledge of all the different food programs that are out there. So I'm glad that point was brought up because I agree. Obviously, when folks are lacking food, it impacts so many other aspects of folks' work. I'm going to filter through some of these other questions here. Or Sarah, would you rather folks come off mute
No,
now,
I think
please? Or...
no, I'm gonna keep the
Yeah.
sun up. There we go. Okay.
Okay.
So we had one question about the pyramid, which we did provide the resource, but I do wonder if we could spend just a moment of time looking at like reviewing, because Mandy actually had it on one of her slides. So to just review again, kind of what is the food as medicine pyramid? Because it was mentioned and we lean into it, it would be great to walk through it just a little bit. I don't
That's
know
a
who
great
wants to
point.
do it. Mandy, it's your slide. Everybody has a component. We all know it. We'll go to you, Mandy.
Okay. Yeah. So obviously medically tailored meals are at the top, medically tailored or supported groceries kind of depends. Certainly for our network, we do have a registered dietitian that is building and designing those food boxes. Produce prescription programs. Like I mentioned, our program follows the initial phase of the nutritious food boxes, then by produce prescription programs. Sometimes that can also look like programs that are part of SNAP or federal programs like Double Up Food Bucks, where you can increase your purchasing power by purchasing produce at farmers markets. Colorado is part of a pilot where you get an extra dollar up to $60 for SNAP recipients for purchases of fruit and vegetables. We know programs that incentivize that. And so that is kind of in those nutrition security programs. Aside from the supplemental nutrition assistance program, SNAP, there is also WIC for women, infant, and children, school meals. Colorado has healthy school meals for all. So there's a variety of nutrition programs that are federal and then implemented in the state, of which our network does operate a number of those. And then you have your population level healthy food policies and programs. A lot of those look like local programs at schools, at communities, food policy. Denver has a food policy. Some other local municipalities do around food security and just general food policies, but a lot of different programs at that like baseline entry level for population level healthy food. I think I touched it, but somebody else jump in if I missed something.
I think that's great, Mandy. And I think the main reason we use the pyramid and kind of talk about interventions this way is we're looking at the population of folks that these interventions are going to be kind of tailored to. So the pyramid moves from the top down, from treatment to prevention, meaning medically tailored meals are typically made available for folks who are, managing multiple chronic illnesses, have, multiple comorbidities. They really need a very specific, targeted, and often highest cost intervention. But these are also like our highest utilizers of the healthcare system sitting at the top of the pyramid. And then as we move down, of course, the pyramid gets larger. And so we're focusing on kind of broader populations of folks. And then I'm also going to call out that nutrition counseling and education spans across all of these areas of the pyramid. We've talked about it a lot on this call already today, but we can't just hand someone a meal and think that that's the end of the conversation. We can't just hand someone a bag of groceries and call it done. We need to have that continuous engagement with our clients, provide them the nutrition counseling and education that's really tailored to their specific needs as well. So that's the food as medicine pyramid. And I did link to Tufts University out of Boston has a really great food as medicine program. And so they published just a 3-pager on food as medicine kind of broadly, and it includes the pyramid there too. So that link is in the chat if you would like to access that.
And Nick, I just want to jump in and touch on the question about when a food bank is lacking food and it impacts those partners in the community that we often supply food to. And yes, connecting and understanding of the resources. But since I brought it up, I want to reiterate it around policy and how important that is. That is the core function of Feeding Colorado across our network, is to talk about policy and things that were brought up on the call. I know Erica mentioned food deserts, and the opposite of that being food swamps, where it's less nutritious food that's ready available. So that is all policy. How do we ensure that is access is available regardless of communities? And right now in Colorado, some of the cuts, federal cuts, to looking at that impact, particularly in our rural communities. And there is a significant connection between SNAP recipients, Medicaid patients, and food insecurity. So addressing those full components is so important. And why I always encourage people to talk about those impacts, to share those stories, to help us elevate all of our voices in what those impacts really look like on the ground, so we can all keep doing the work we're doing.
We got one question yesterday that I thought this panel might help answer. And it's a big one. So, get ready. So why are we focusing on medicalizing food rather than culturally reorienting us and the big money food producers to incentivize healthy living? Why do we do not have a medical system? We have multiple overlapping, competing, and confusing systems, none of which work. Other countries don't medicalize food, but are healthier. Why are we doing this? Is it because that's where the money is, so we go get it?
That is a big question.
Yeah.
But I appreciate it
was
because
asked panel yesterday, and I was like, I feel like this group would be a great one to answer. And it's kind of the $1 million question. Honestly, a lot of folks are asking this, and I think it's an interesting one. Go ahead. Sorry, Nick.
Yeah. I'd like to quickly just add in a little piece about where I see it from a medically tailored meal provider and advocate standpoint, which is, first of all, agree with many of the points brought up in that question. And when we talk about food as medicine, we really are talking about food in the healthcare system, almost as you would talk about medication, like prescription medications. These are interventions that are being essentially prescribed by a doctor or a healthcare professional for individuals with really complex needs. And so at Project Angel Heart, we're providing medically tailored meals for folks who don't just necessarily need like a low sodium diet, something that's relatively easy to achieve. We might have someone who's living with comorbidities, including heart failure, kidney disease, cancer, and COPD. And every time they go to their respective doctors for each of those diagnoses, they're getting a laundry list of things not to eat, what to eat, how much to eat, when to eat. And when you start adding all of those different recommendations or prescriptions on top of each other, it can be so exhausting and confusing and frankly impossible for folks to follow and navigate. So agree that we need kind of more of a cultural shift around food, and that goes into a lot of what Mandy was talking about with policy. But also we do need to be funding programs that are addressing these really, specific and acute medical needs, and not just, again, providing the meals and then leaving, but providing that step down approach to make sure that, they're not just kind of receiving 10 weeks of meals and then that's it, but providing that education along the way. So that's why we're working with dietitians to make sure that that very specific nutrition need is being met. But Mandy, I saw you come off mute too, so I'm curious your thoughts on this.
Well, I would just say from a nonprofit perspective, I have yet to find the money in sustainably deploying these solutions.
That's a great point.
But I do hear the comment and the concern around having a sick care system and the need for a well care system. And I do think that is going to take all of these pilots, these interventions, these organizations doing this work, who are doing it rooted in community. It is a different lens when you start from the neighbor-centric perspective, to really shift that, to shift culture, to shift attitude, to see what actually works at this population level when you are addressing barriers to health. So I think we're getting there, and I agree asking those questions. And the conversations we're having around health from across political spectrum is super important right now. So just continuing to ask those questions.
Yeah, I think I would jump in and say, again, I agree with kind of where that question is coming from. And I think the food as medicine movement is actually doing exactly what the person is asking, right? We are, I think, trying to shift the culture around food and health using the existing framing, right? Like we're kind of trying to change the systems almost from the inside out. And I think when you look at systems change, you need a combination, right? You need a combination of inside out and outside in to really make effective, long lasting change.
And to add to that, thinking out loud, we're, as America, as a culture, right? There's still going to be corporatized food producers who are not going to always provide the most healthy food. And that is what's going to happen. But what we can control is what Project Angel Heart and Feeding Colorado are doing. They're starting to show people how to eat healthy and what that looks like through these interventions. And going back to what Mandy said earlier, early childhood interventions, we need to start teaching our culture from an early age how to eat healthy. So there's some programs in schools, for example, that you can bring your parents to school for an after school cooking class, and you'll learn how to take those fresh vegetables from your garden and start to make healthy meals. So you can take that from the big lens, and we could also probably put that into a more specific lens when we look at different cultures within our state of Colorado. And how do you take, let's say, for example, because my husband, he is Mexican and he loves his Mexican cuisine, and I do as well. And it is loaded with sodium at times. However, what we're starting to teach him is how do we create the same meal but healthier? What are some alternatives? So it's going to be that educational component along with that after component with the medically tailored meals.
Well, thank you for taking that very difficult question at the end of a wonderful panel. You all are such a wealth of information. We could have gone for another hour, I am sure. Thank you. You all are an exceptional example of how Colorado leads the way in collaboration first. We are a give first kind of community across Colorado, and you exemplify it. So, but in the absence of a live audience, we are going to say, yay, thank you. You all are so exceptional. Thank you for your time. We do have another panel that we have scheduled for next Friday. That one will focus on aspects of what are we seeing in the digital health community around changing behaviors and looking at populations. That information about that panel is in the chat, or will be in the chat soon. And this recording will be available with the recordings of the other panels at the end of the whole summit. So thank you all for your time, energy, and effort. Thank you to our panelists, and you all have a wonderful rest of your Friday.
Thanks, everybody.
Thank you, everyone.
Thank
Good to
you.
see you all.